All right, this is the ice massage that we do here. So what we'll do is take a towel and place it under the area that we're massaging just to catch any water that comes off. And then you'll take one of these cups that's filled with ice water. You can get them in the freezer, and you'll just tear off the top part of it so that the ice is exposed like this. And then you'll just put the ice on the area that you're massaging and just kind of some light pressure and just kind of moving around in circles around the area you're treating. And this massage we do for 5 minutes just because it can be hard for the patient to handle anything longer than that. And so you just want to check and make sure they're doing all right and not getting too cold. All right, this is the trigger point massage or trigger point release. So what you'll do is you'll take a towel and put it under the area you're treating, or you can tuck it into like their sleeve if you're doing a shoulder or something like that. And what you'll do with this one is you're just trying to find the knots in a certain area and try to help them release. So you'll take the lotion that we have in the bottle warmer and put some on your hands or on the area, and you'll just kind of rub around until you find one.
If you're looking for knots to massage out, then what you need to do is just put some lotion on your hands and just slowly push over that part of the body until you find the knots. So don't just go poking around, use the broad part of your hand and feel for anything that is abnormal. And then once you find those points, then you can put your thumb or whatever else on that trigger point.
And when you do, you can use your fingers, your thumb, or your knuckles. You just push down pretty hard, but also make sure you're not hurting the patient. It'll be a little uncomfortable, but you just kind of push down. You can do some small circles on the trigger point, and you just hold it for a few seconds, up to about 30 seconds until the knot releases. Then you move on to the next one, and you'll usually do this for about 5 to 10 minutes. If you've been doing it and you're not finding any more knots, you don't have to keep doing it for a full 10 minutes. And you just want to make sure you're checking in with the patient constantly to make sure you're not hurting them. If it's at an area where they'll need a gown or anything like that, give them a gown, make sure they're in a room or in a curtain so that they stay modest. And then at the end of the massage, you just wipe off any lotion that's on the area. For massages, it's usually best to have them on a high-low table so you can adjust the height if you need to and make sure that you're not reaching up for massage or anything like that. And usually you'll want to have the body part slightly elevated just so that blood flow and everything will go out of the area back towards the heart. And then while you're doing the trigger point massage, you want to make sure that the muscle's not kind of flipping under your finger. It's okay to do some small circles, but just as long as it's not flipping, you'll kind of feel like it's kind of snapping under your finger. That can irritate the area and cause a little bit of pain.
Another important thing we need to talk about is protecting yourself and your body. So if you have a high-low table, make sure to put that high-low table down so that you can lean into the massage. Another thing that you need to focus on is if you're using your thumb for a trigger point massage or anything like that, have something behind it so that you're not just putting pressure through one thumb, because it can hurt your hands and fingers if you're there for a long time. We don't do an incredible amount of massages here, but over time it will wear on you if you're not using correct mechanics. So just make sure to have the table low, keep the patient close to you, and then to support your hand or whatever other body part if you can. Use your body weight.
All right, this is the retrograde massage, and with this one it's really important that you have the body part elevated because this one helps to get rid of swelling in an area. So if you're doing like an ankle or foot, you'll have the body part elevated, you'll put the towel underneath to catch any lotion, and then you'll take the lotion from the bottle warmer. You're just gonna do, you want firm pressure but not hard enough that it's causing pain to the patient. So what you're gonna do is just kind of get a big surface area in your hand like this, and you're just gonna kind of do firm strokes going towards the heart, and you want to maintain constant pressure with your hands like this. And if you start to go a little bit harder in the pressure, you'll want to make sure you're going at a slow pace so that it doesn't irritate the area or cause pain. And with this one, you just check in with the patient to see how it feels, to see if they want you to go a little lighter, a little bit harder. Every patient's a little bit different with what they can handle.
So for the video and for demonstration purposes, Megan was behind the table so that you could see it better, but really, ideally, she would be as close to that body part as she could be, so she would switch to the other side of the table. And then as far as position, the table should be just a little bit lower for her. Again, for demonstration, it was higher. Also, she obviously was not able to demonstrate a full massage, but you're not just going to stay in one place. Swelling in one area, you are going to want to get all around that area, so not just stay on the top. So if it's a foot, you're going to want to squeeze through the whole foot. If it's an ankle, you're going to want to be around the whole ankle at some point. That doesn't mean you have to do it all at the same time, but it is important to cover that whole circumference of the area.
Massages, if you can use both hands as you're doing it, that's the best thing you can do. And also, instead of coming down and then lifting your hands back up, just kind of maintain contact the whole time. And then let that off. Flipping.